Hello students, this is Shelly. Hope you are all doing well and taking care of yourself. Tonight we are going to talk about the musculoskeletal system. That is Unit 8 and it is Chapter 21 in your textbook. Functions of the musculoskeletal system: it gives shape and form to the body. It maintains posture, permits movement, protects internal organs, stores calcium and phosphorus, produces heat, and also produces some blood cells. Obviously, it gives shape. The bones help form the body, the muscles help form the body. Our bones is what holds our posture up. Muscles and bones move together for movement. Protects our internal organs. So our internal organs, of course, are your heart and your lungs, and those are obviously protected by your rib cage. Calcium, phosphorus is in our bones. Muscles produce heat, and some of the blood cells that are formed, or like the red blood cells, are formed in the bone marrow. Normal changes of aging in the musculoskeletal system. As we get older, our muscles weaken and they lose tone. Bones lose calcium. Height is lost due to shrinkage of the space between the vertebrae of the spine. Loss of muscle mass causes weight loss, and joints are less flexible. Disorders associated with the musculoskeletal system: osteoporosis is bone loss. It's where the bones become brittle and break easily. Arthritis is inflammation of the joints. In osteoarthritis, it is a degenerative disease where there is a loss of cartilage. And cartilage is what connects the bones. Rheumatoid arthritis is another type of arthritis. It affects the membrane that lines the joint capsule. Rheumatoid arthritis is considered an autoimmune illness. I believe psoriatic arthritis, there's other kinds that also fall in that category as well. Autoimmune itself means that the body's own immune system attacks itself, so it's kind of fighting itself. Amputations. Amputations are surgical removal of some or all of the body part, usually necessary due to disease, circulatory problems, cancer, or trauma. Common is somebody who has a diabetic sore that doesn't heal and ends up having to have their toe or their foot or something amputated. That's one of the diseases that could cause it. Peripheral vascular disease could be a circulatory problem. It could have cancer. Limb amputations are performed either above or below the knee or the elbow. It's commonly referred to BKA is like below the knee amputation, or AKA above the knee amputation. You'll see that abbreviation a lot. Phantom pain or sensation is the feeling that a body part is still present after it has been surgically removed or amputated. The sensation is real. They really do feel like it's still there. And the pain is real, and is something they will actually give pain medicines to treat the pain. Fractures are, there are different types of fractures of the bone. Pictures is some of the different types of fractures. Oblique, you can see, is not straight across. Comminuted, it's kind of crushed and there's pieces coming out. Spiral fracture would be caused by somebody maybe grabbing an arm or leg and twisting. And then compound is where it's broke completely through. And then we also there's a nice picture of an open fracture, and that fracture of the bone is actually coming through the skin. So often with fractures, people will have a cast. So it's important you guys know how to take care of people with casts. There always should be padding around the edges. They are not to get wet, so if you have to give them a shower or anything, you're going to cover them with a plastic bag. You need to keep it clean, elevate the extremity to reduce swelling of wherever the cast is, assist with canes, walkers, crutches as needed, and pictured there is a bed cradle. Sometimes when somebody is, they'll put that bed cradle under the sheets to just kind of protect the leg and keep the sheets and covers off of the cast. Another common surgery, especially in the elderly, would be joint replacements. There is a hip replacement. THR stands for total hip replacement, and that is when they take the ball and socket joint and the top part of the femur and replace that. When you're caring for somebody who has had a hip replacement, you need to pay attention to what their order is as far as ambulating or walking. PWB, which stands for partial weight bearing, or NWB is non-weight bearing, and then FWB, full weight bearing. So the doctor will say, whether they want them to be able to put partial weight on the affected extremity or absolutely no weight bearing. That would mean they would be a total lift, or if they have full weight bearing. So that's just something important for you to know. This person is wearing what's called an abductor pillow, and it just, one of the risks after a hip replacement is for that new ball and socket joint to kind of slip out of the socket. So this is used to prevent it from coming out of the socket. Total knee replacement is also a common joint replacement surgery. TKR is the abbreviation. Somebody who has had a total knee replacement will be often on this machine you see here. That's called a continuous passive motion. So what that does, it just goes up and down, kind of like they're doing range of motion continuously on that knee to keep it from moving and swelling and promote healing. There are 3 types of muscles. We have the skeletal muscles. They are voluntary muscles. They control body movements by contracting and relaxing. Skeletal muscles are what they sound like. They are muscles that stretch over the skeleton. Their appearance appears lined, or what they call striated. Smooth muscles are the involuntary muscles. They make up the walls of the organs. They are not under a person's conscious control. So things like swallowing, digestion, breathing, things like that are all involuntary muscles. We don't have physical control over those. So most of anything that is a vessel, whether it's your colon or your blood vessels or your lymph vessels or anything like that, would be smooth muscles that are involuntary. Cardiac muscle is what it sounds. It's the muscles in the heart, and they're only found in the heart. So that was the muscles. Now we'll move on to the 4 types of bones. We have long bones. Pictured over there is the femur. You can see the top of the acetabulum there, the ball and socket joint. Femur and humerus look similar. They are both ball and socket joints at the top, the point of attachment. And then we have short bones, which are your carpals, is what the arrow is pointing to. And then the tarsals are the ankle bones. Flat bones, that would be considered, you see the sternum or the breastbone, that's where we place for our hand for CPR. Scapula, you're not seeing that on that picture, but that's your shoulder blade. Irregular bones are bones of the vertebrae or the spine. And then there's the different types of joints. We have joints that are considered immovable, An example of an immovable joint would be the cranium, because there's sutures there, but they are closed, they don't move. Slightly movable would be your pubis bone, and then movable, freely movable would be ball and socket and hinge joints. Joints are the points where two bones meet. They provide movement and flexibility. So when you look at the hip and shoulder joints, they are ball and socket joints. And then the elbow and the knee are hinge joints. And that is the end of that. Thank you for listening.